To drink or not to drink. The U.S. Surgeon General's call for cancer warnings on alcoholic beverages. The recent statement by U.S. Surgeon General Dr. Vivek Murthy, advocating the inclusion of explicit cancer risk warnings on the labels of alcoholic beverages, marks a significant milestone in the realm of international public health. This proposal is founded on a robust body of scientific evidence that, since the 1980s, has documented the association between alcohol consumption and various forms of cancer. Despite the growing availability of research and epidemiological data underscoring this correlation, a striking lack of awareness persists in the general population regarding the oncological risks linked to alcohol intake. 1. Scientific evidence and scope of the problem. According to Dr. Murthy's report, alcohol consumption is a clearly established risk factor for at least 7 types of cancer, including breast, colon, liver, oropharyngeal, and esophageal cancer. The statistics cited indicate that in the United States, alcohol is associated with approximately 100,000 cancer cases and 20,000 cancer-related deaths each year, a figure that even surpasses annual fatalities resulting from alcohol-related traffic accidents. This finding takes on greater significance in light of surveys showing that less than half of the U.S. population recognizes the direct relationship between alcohol use and cancer incidence. 2. The role of warning labels. Updating warning labels on alcoholic beverages to include explicit references to cancer risk aims to bridge the current information gap. International experiences, such as those in Canada and South Korea, have demonstrated a significant rise in public awareness after the implementation of more assertive labeling. These labels do not seek to limit consumers' freedom of choice, but rather to provide essential information that enables individuals to make more informed decisions and ultimately reduce the prevalence of preventable diseases. From a comparative law standpoint, one can observe how labeling requirements for products that pose potential health hazards, such as tobacco, have evolved to include explicit warning messages. Such measures have proven effective in deterring or at least reducing risky consumption patterns. In the case of alcohol, its widespread social acceptance and cultural significance pose barriers to public health strategies, making the deployment of clear, unequivocal labels a potentially powerful, immediate, and far-reaching tool. 3. Legislative implications and public debate. Introducing these messages on alcoholic beverage containers would require revisiting existing federal laws that govern labeling requirements, which have remained largely unchanged since 1988. Highlighting oncological risks, therefore, necessitates legislative reform, a process likely to provoke a polarized debate, especially given the potential opposition from certain industry sectors and conservative political actors. It is noteworthy that Dr. Murthy's recommendations extend beyond revised labeling, also proposing a re-evaluation of the current daily consumption limits reflected in dietary guidelines, which may spark further controversy in legislative arenas. From a public health perspective, however, the evidence is unequivocal, warranting the modernization of these guidelines. Various international bodies, including the World Health Organization, WHO, have reiterated that no amount of alcohol consumption can be considered entirely safe. Meanwhile, medical organizations such as the American Medical Association, AMA, have voiced their support, recognizing alcohol intake as a modifiable risk factor for cancer. 4. Toward a comprehensive prevention strategy. While cancer risk warning labels constitute an important measure, they are not sufficient on their own to address the broader health and social implications of alcohol consumption. A comprehensive approach, combining taxation policies, restrictions on advertising, promotion of healthy lifestyles, early education, and early intervention programs for high-risk populations, appears to be the most effective strategy for substantially reducing alcohol-related cancer incidence. It is crucial for health professionals, including physicians, psychologists, and other specialists, to actively disseminate accurate information both to the scientific community and to the general public. Conclusion. The proposal to include explicit cancer warnings on alcoholic beverage labels is a direct response to the need for heightened public awareness of a major health threat that, according to current estimates, results in tens of thousands of deaths each year. Although political and economic resistance can be expected, the initiative by the U.S. Surgeon General aligns with the principles of prevention, transparency, and social responsibility that guide contemporary public health policies. Ultimately, effective labeling measures and a reassessment of recommended consumption guidelines serve not only the broader public interest, but also uphold the fundamental right to health.